Good Monday morning, everyone. We're continuing our talk about the brain, depression, and anxiety. And today we're going to go a little further and talk about blood work and how to identify inflammation in your blood work, which could lead to depression and anxiety. The last post we talked about serotonin, the happy chemical. And if serotonin is backed up, it could lead to PTSD, OCD behavior, ADHD, aggressive behavior, depression, and anxiety. So tryptophan is an amino acid in our diet. We don't naturally produce it. We have to get it from chicken or turkey or beef, cashews or spinach, and it turns into serotonin, which then turns into melatonin, which helps you sleep, helps your bone growth, helps you stay relaxed and calm. Now, we want serotonin to break down naturally so we don't have those symptoms. But another indicator on your blood work is high kynurenine, and this is what I'm talking about. Tryptophan should turn to serotonin. But if you have high inflammation or high cortisol levels from chronic stress in our everyday lives, or have high sugar in your diet, the inflammation can keep the tryptophan from turning into serotonin. This leads into kynurenine, which is an inflammation marker that you can go to Genova Diagnostics and get these levels read. Now, kynurenine, if it backs up, it can lead to psychotic behavior or neurosis, tics, even problems with Alzheimer's patients. They find high levels of kynurenine in their blood, and even children on the spectrum with autism. So you can go to Genova Diagnostics, get their NutriEval, get those levels found out, and it can tell you if there's high inflammation that can lead to your depression or your anxiety. Another one is the CRP, the C-reactive protein. Studies have shown that there are links between high levels of CRP and the disconnection between the prefrontal cortex and the pleasure centers of your brain, which means the higher the inflammation from sugar, carbs, and starches can actually disconnect your gratification centers from your executive thinking, which means you will act out of instant gratification instead of thinking normally, calmly, and seeing the whole picture just from sugar. So the higher your CRP levels are, the higher inflammation is, which means you can be acting out of instant gratification, hurry up, get it to me, and not thinking your decisions for your life well thought out. The next one is hemoglobin A1C. Hemoglobin A1C. Remember, hemoglobin is a protein in your red blood cells that carries iron and then attracts oxygen, so you have oxygen in your blood. But what happens when you have a diet that is too high in sugars and refined carbs? You actually will have blood sugar attached to the hemoglobin. So the hemoglobin actually, it's called glycation. The hemoglobin attaches to blood sugar and it gets very inflammatory in your body. So if you have high levels of A1C, that's where people use A1C as an indication of diabetes. So if this is the case, you won't carry oxygen well. You get very inflamed. And the problem with this is that you have high inflammation, it decreases brain function. So these are three simple things: kynurenine, CRP, and hemoglobin. If these are high, it could lead to depression and anxiety. So the next question is, Doc, what do I do? Like, you're just telling me these things. Now, the breakdown of these substances to help you, that benefit you, have been found in certain vitamins and minerals. Now, you need to find a holistic kinesiologist or practitioner that helps test certain vitamins and minerals on you, or get NutriEvaluation about your mineral content and vitamin content in your blood. But on the simple level, vitamins A, D, K, B2, and B6 have all been shown to help break down kynurenine. It also helps reduce blood sugar issues and helps resolve some of the CRP problems you have in your body. But again, find somebody that can help test you on that. These can be resolved. But if I could tell you one thing that you could do to help your blood work, literally see changes in your blood work, is reduce your refined carbs, refined sugars, stop eating so many grains like corn and wheat, and cut out dairy. I know it's a hard thing to do, but I've seen dramatic changes in my patients. When they just did that, things have changed 70 to 80% better on their blood work. These have changed. Some people, they actually almost got out of their diabetic numbers because they just stopped eating these food. Remember, high inflammation can reduce brain activity. You can make the change that actually changes your blood work. You can do it just by reducing those things in your life. This was long, but I love y'all. Have a great week.